we've all got a part to play in that by following the guidelines, including in London. I mean, as I say, if the analysis is correct and London is that much lower than elsewhere, it's important we don't allow that to rise again. So whether it's London, whether it's the North East or any other part of the UK, continuing to follow the guidelines that are set out is important in terms of keeping that R level within some control.
Care homes, it's emerged today that ministers were warned there was a sustained transmission of coronavirus 2 weeks before that guidance was published to care homes, saying that it was very unlikely that residents would be affected. February the 10th, the Scientific Pandemic Influenza Modelling Committee, SAGE, said it is a realistic probability that there is already sustained transmission in the UK or that it will become established in the coming weeks. 15 days later, on February the 25th, Public Health England published that guidance saying there is currently no transmission in the community. And that advice didn't change for another 3 weeks, March the 12th. Is there going to be a full inquiry into what has happened at care homes?
I think let's bear in mind where we were. So on March the 13th, I think there was still any single death from this virus is a tragedy, and it affects families, it affects everybody who knows that individual that we have lost, and all of our thoughts go to people who have been affected by this. I know myself people who have been affected by coronavirus. But on March the 13th, we had 10 deaths in the UK, and even at that stage, we were already, anybody who was going to a care home who had symptoms, we were advising care homes to take social distancing, to ensure there was isolation in place, that there were proper procedures in place. So I think we have to remember the context of that point in time. And we were still at that point, obviously, looking at testing people and ensuring that people on the front line, and the focus being for a new test with a new virus, being on the people who are working on the front line and those with symptoms.
But my specific question was that advice was already out there. It had been fed into SAGE 2 weeks before the advice was written and published, that there was sustained transmission in the community, not, as the advice was, that there is currently no transmission in the community. That was against the advice that the government had been given.
No, well, actually, I would say my understanding is at that point in time, the advice we were giving to care homes was to, when people were going into care homes, to ensure they were practicing proper isolation where people had symptoms. There was people who were going from hospital to care homes. There was guidance around how they dealt with that. So we were managing that issue at the time. And as I say, at that point, and even on March the 13th, I think we were dealing with that point, about 10 deaths in the community from coronavirus. It was a very different situation.
We are approaching the middle of May. It is the 15th of May now, and that is when Matt Hancock said the government had aimed to recruit 18,000 contact tracers by fundamental to this next phase of our recovery. Have all 18,000 contact tracers been hired now?
I don't think we've got to 18,000 just yet. I think there's about 15,000 applications. We're looking to, as you say, get up to 18,000. And
that's applications, you say, not actually people that have been hired?
Yes, and and it's fantastic that people have applied for that, and we would encourage more people to think about applying for that, because that's a very, very direct way in which people can play a hugely important part in how we deal with this virus, particularly as we come out of exit and with a view to making sure that we stay on the other side of this virus.
OK, so when do you aim to reach that target that was due to be the middle of May, which we are at now, of 18,000 people actually hired?
Well, as I say, we're encouraging people to apply for that. We've got 15,000 applications at the moment. I know the health team are working through those applications as quickly as possible.
So working through, sorry, I know we are getting short on time, but I just want to establish these figures. They are important. How many people of those 15,000 applications have currently been hired?
As of this morning, I'm not sure exactly how many of the 15,000 have been hired. And earlier in the week, it was about 1,500. It would have gone up since then. Obviously, these things move up very quickly once the process starts. But the key thing is to encourage more people to apply for that, because also the more people we have doing that work, the quicker and wider we can run that tracing, the better we get an understanding of things as we move forward. And that's important in terms of keeping control of that R level as we go forward and understanding its movement, if any, around the country.
But 1,500 earlier on in the week is a very, very long way short of that 18,000 that we were told would be hired by the middle of May. And there is a lot of interest in this because this test, track and trace is fundamental to how we move forward.
Yeah, and it's absolutely right. That's why we want to get that upscale as quickly as we can. Rather, if you remember, like the testing, we had a brand new test for a new virus. It took us a bit of time to get up from 0 to that 2,000, then got up to 100,000. It's now moving exponentially faster and higher all the time, aiming to get to 200,000 by the end of the month. Similar with something like this. This is a new program of recruitment. We're encouraging more people. We want to get more than the 15,000 we had applied as of yesterday. As we start to get that recruitment process moving through, it can move quicker and quicker. Make sure we've got the right people with the right skills, ready to train them to be able to take on this job, which will be so important as we go forward.
Well, we also heard from Labour's Rachel Reeves, who blames the different approaches to lockdown across the 4 UK nations for a lack of clarity.
The numbers for Yorkshire and for the North East are worrying, and in many ways it's just tracking a few weeks later what we saw in London and the West Midlands. I know that local authorities are working incredibly hard with our hospitals and our care homes, and certainly in Leeds the number of outbreaks in care homes is falling, and that's of course incredibly welcome. The government have got to take a responsible response to all of this, whether it is in businesses or schools or in care homes. We need to be working with local authorities and people in local communities to make sure that the response is right, and work with workers and businesses to ensure that people are going back to work in a safe way, and that we're not risking in any way a second peak in the virus. But the message until last week had been very clear: stay at home to protect lives and the NHS. That clarity of message and that consistency of message has been eroded in the last week, because we now have different approaches in our different nations in the United Kingdom. And I think that does cause some confusion and risks of the rules being misinterpreted in different parts of the country. And that's why I say that as much as possible, it's important to keep a one nation message, to keep that message simple.
Well, later on today, the First Minister of Wales will announce his country's plan to exit the lockdown. Just ahead of his announcement, Mark Drakeford said he was confident people would be happy to have different lockdown schedules on either side of the border.
Not chaos. People in Wales are very used to devolution. We're used to things being different. We have to work harder in Wales, but the UK government as well, to make sure our messages are clear and we don't confuse people by not explaining to them the rules that apply in Wales and the rules that apply in England.
Rob Powell has been listening to all of those interviews this morning and joins me from Westminster. Morning to you, Rob. Let's start with this issue about contact tracing and the recruitment of the 18,000 that the government said would be hired by the middle of May.
Yeah, Brandon Lewis seemingly revealing that actually the government is very far behind that target of getting to 18,000 contact tracers. Now, they're crucial because they'll work alongside this NHS app in order to basically track down who people who have been confirmed to have COVID-19 infections, who they've been close to, who they've been in contact with, and in doing that can hopefully try and isolate the virus and stop its onward transmission. That's a key part of the easing of the lockdown plans, because it means that the measures, the restrictions can be focused on people that have the virus or might have the virus rather than everyone. Now, interestingly, in the last couple of hours since Brandon Lewis did that interview, I'm picking up some concern from within the Department for Health and Social Care that the figures that he quoted to us might not be strictly accurate or correct, but I haven't been given any accurate figures or corrections on that yet. But of course, this is a crucial point because it is part of the strategy to ease the lockdown, an easing of the lockdown which does seem to be going now at different paces in the various nations across the United Kingdom. You heard from the Welsh First Minister there outlining a three-stage approach, a traffic light system for easing the lockdown in his country. Already Wales and Scotland and Northern Ireland are moving at a slightly slower pace. Now, Brandon Lewis, the Northern Ireland Secretary, said that was because the countries all had different rates of infection, different reproduction rates, the R rate. Well, actually, you look at the figures, and it is quite similar across England, Wales and Scotland. So this might be more a case of different policy and politics rather than strictly different rates of reproduction.
Since the coronavirus crisis began, most MPs have had to attend Parliament remotely. But now the government is calling for them to return as soon as next month. Our political correspondent, Tamara Cohen, looks behind the scenes at how our virtual democracy is working.
MPs have been largely cleared out of their green benches and are embracing democracy virtually.
But if I want to submit a question, I just go on there.
With varying levels of enthusiasm.
Scrutinising government just is hopeless. The hybrid system, we tried, but it just doesn't work.
And why is that? What are you not able to do?
Well, I think the main thing is you can't intervene, you can't question a minister during a debate. The government is getting a free ride when it comes to scrutiny, and good government needs a proper scrutiny from Parliament.
It's not the most comfortable place to be sitting for 2.5 hours, but we'll see how we get on.
For this brand new Labour MP, the youngest in Parliament, digital working is very much second nature.
It's clearly not safe for Parliament to return yet, but it's right that whilst we are away, that we're able to scrutinise government properly, particularly during a pandemic when the government's making very high-stake decisions.
You can hear every step in Parliament's deserted hallways. The place was finally vacated at the end of March as the COVID crisis escalated and a string of MPs was struck down. Now it's partially up and running with a huge effort to enforce restrictions on attendance and a video conferencing system prepared by staff within days. Under the current social distancing rules, only 50 people can sit here in the House of Commons chamber. As you can see, the seats are labelled where you can sit and where you can't. MPs were surprised and concerned by the call for hundreds of them to come back here at the start of June. Many feel strongly that this historic building needs to remain restricted. But the government say MPs should set an example to the rest of the country by coming back.
How can we say to our school children, you're safe, going back, some of them, but that we're not, that we're going to hide away while school children are going back? Is that the right message?
Thousands of people call Parliament their workplace, including journalists who would normally crowd into daily briefings with the Prime Minister's spokesman. Now that's remote too.
All I can hear is somebody's dog barking. Can you all check you've got your phones muted?
Their elected chairman does the whole interrogation on their behalf from his kitchen.
They can't get their staff tested, they can't get their patients tested, and they're looking at this huge gap and asking what's going on. I mean, do you accept that you haven't moved things on quickly enough?
As the country slowly, cautiously unlocks, politicians want to send a signal, but risks lie everywhere. Tamara Cohen, Sky News, Westminster.
Just after 9:15 and coming up after the break, could the barbers be the place to help men suffering from mental health issues once the lockdown ends?
That's coming up next on Sky News. Well, now for the story behind the headline. I'm Dermot Murnaghan, and I'm the new host of the Sky News Daily Podcast, bringing you news and in-depth analysis from our team of specialists. I'll be joined by our experts to delve into the stories that matter to you. Trusted news with no agenda. The Sky News Daily Podcast, wherever you get your podcasts from.
Having a party.
I'm having a party, a girls' party. Yay, where are your drinks, girls?
It is nothing short, but an amazing day